An amalgam of medics at MP Shah Hospital are keenly studying the meanders of a 3-year-old child's ear. She is scheduled for surgery. It is a pool of ear, nose and throat surgeons, nurses, anesthetics, audiologists and speech pathologists. It's a few minutes past midday. Lucia Otike is being prepped for a surgery to repair the inner part of the ear responsible for hearing, scientifically known as the cochlear. She's one out of 3 children scheduled for the operation in this hospital.
Children who are in this group of implantees are hearing impaired, profoundly deaf, and have found no benefit from use of hearing aids.
The importance of cochlear implant technology is that it helps people who cannot benefit from hearing aids because their hearing has completely gone. Either they were born without hearing or they have had diseases that destroyed the organ of hearing in the inner ear.
Her doctors are hopeful that the procedure will enable her to hear for the first time a month after the operation.
Well, this particular child was actually born prematurely, and prematurity is one of the risk factors for hearing loss. But luckily, the child has caught up in all other aspects of life, has grown well, the child is intelligent. We would call that a congenital hearing loss because it was present even at the time of birth. And therefore, this child who is 3 years, 8 months has not yet developed speech.
Hearing loss is the most prevalent sensory disability affecting about 360 million people globally. With cochlear transplant, people with profound hearing loss are able to restore their hearing ability. For children, it is the beginning of journey learning spoken language. 8 out of 10 people with hearing loss globally live in low and middle income countries in the world. In Kenya, conservative estimates show that over 600,000 people suffer from the silent disability. Locally, the implant of the device cost about 2 million shillings.
So this is an implant where it's an electronic device which is highly sophisticated, and it is operated and placed in the inner ear of the patient, and then it helps to stimulate the nerves which otherwise were not getting stimulated. Naturally, a child who is born without hearing, the earlier you do the operation, the better. Ideally, it should be done below the age of 2, and even if possible before the age of 1. That way the child has maximum chances of developing normal language. The day you put the implant and the day you switch it on, of the procedure that we call the switch on, which is about 1 month after the date of surgery, that's when the child starts hearing.
Hearing loss in children is mostly caused by infection of the inner ear. The first cochlear implant surgery was successfully done in Nairobi in 2012, midwifed by the Cochlear Implant Group of Kenya. And to date, 20 people in Kenya have had their hearing restored thanks to technology. Eunice Omolo, NTV for the Health Assignment.